تغطي السيسمنت أوف ذا هارت الجزء الثالث شبه تقريبا السادس دكتورة حكيمة السادس of the heart حتى يصير complete assessment of the heart لازم يحتاج إنه ويا another system اللي هو الثوراكس والأبدومن شباب مثل ما قلنا بالسيستمات الأخرى إنه هذه أنتم ماخذين بالكورس الأول وبهذا الكورس مطالبين فقط بالكومبليت assessment of the heart اللي هو ويا الأبدومن ويا الثوراكس. فالمحاضرات هناك الموجودة بالكورس الأول تراجعوها لأن هي مطلوبة من عندكم. أما أنا هسه كون جبت لكم أفلام شوية أذكركم بيها أساس تساعدكم بالأسسمنت شباب. الأول اللي ثيرد فيلم include فيلم يعني هذا الفيلم الثالث اللي راح يتضمن تشوفون لما تدخلون تشوفون assessment of the heart تشوفون الانسبكشن 5 key landmark تشوفون البالبيتيشن of the
Move to the right side of the table. Check his apical pulse. Inspect the 4th and 5th intercostal spaces at the midclavicular line. To help visualize the pulse better, you can repeat the process with the patient on his left side. Remember, in about half of patients, the apical pulse isn't visible. Palpate the apical pulse even if it's not visible. It should feel like a short, gentle tap and should be palpable in an area about 1 centimeter by 2 centimeters. Using the ball of your hand, systematically palpate the heart's borders in the sternoclavicular area, aortic area, pulmonic area, and left ventricular area. Note any lifts, heaves, or vibrations. Now auscultate for heart sounds with the patient in 3 positions: lying on his back with the head of the bed raised 30 to 45 degrees, sitting up, and lying on his left side. Auscultate the heart at the right second intercostal space close to the sternum, along the left sternal border in each intercostal space from the 2nd through the 5th intercostal spaces, and at the apex. As you auscultate using both the diaphragm and the bell of the stethoscope, determine the patient's heart rate and rhythm, and listen for the normal heart sounds, S1 and S2. S2 is best heard at the base of the heart and corresponds to pulmonic and aortic valve closure at the end of ventricular systole. S1 is best heard at the apex. It corresponds to mitral and tricuspid valve closure at the start of ventricular systole. It should coincide with the carotid pulse. Especially note the timing of heart sounds in relation to the cardiac cycle, and stay alert for abnormal heart sounds, such as S3 or ventricular gallop, which may be a cardinal sign of heart failure, and S4 or summation gallop. S4 results from vibrations caused by forceful ejection of blood from the atria into ventricles that expand less than they should. For a male patient, continue by inspecting the breasts, which should be smooth with no nodules or swelling. Remember that gynecomastia, or breast enlargement, is normal in males only during puberty. Next, palpate the nipples and breast tissue, checking for nodules. You should not find